Hello everyone, welcome to the video. Today we'll be discussing about the drug dexmedetomidine. So by classification, it is a selective alpha-2 agonist. So it is a highly selective drug. It is almost 1600 to 1 times more selective for alpha-2 as compared to alpha-1. It is the S enantiomer of medetomidine. Coming to the mechanism of action, so it acts on both the alpha-2 receptors and the imidazoline receptors. Coming to its alpha-2 action, it acts on the alpha-2 receptors and it activates the G inhibitory proteins. So when it activates the G inhibitory proteins, it leads to decrease in the activity of adenyl cyclase, which will lead to decreased levels of CAMP, which will activate the potassium channels. Now due to this potassium efflux, this will hyperpolarize the presynaptic membrane. Hyperpolarize the presynaptic membrane, which will lead to decrease in the noradrenaline release. So this further creates a negative feedback loop and it inhibits the noradia release by its alpha-2 presynaptic action. So dexmedetomidine has sedative, anxiolytic, hypnotic, analgesic and sympatholytic effects, which we'll see in the further discussion. So dexmedetomidine, it acts on the pontine locus ceruleus of brainstem and it inhibits the central sympathetic output. Which is responsible for its sedative and anxiolytic effects. Similarly, the dexmedetomidine, it acts on the alpha-2 receptors in the dorsal horn of spinal cord, which will lead to a decrease in the release of substance P, decrease in the release of substance P, which help to mediate it analgesic effects. Now the imidazoline receptors, they are not as well described as the alpha receptors, but it seems that the imidazoline 1 receptors, they seem to mediate the hypotensive effects, while the alpha-2 receptors, they seem to be related to the analgesic effects, and the I3 receptors, they seem to somehow mediate or take some role in the insulin secretion. Similarly, these alpha-2 receptors, they also have their subtypes A, B and C. The alpha-2A is considered to be its primary subtype, which is responsible for its sedative, anxiolytic and analgesic effects. Anxiolytic and analgesic effects. The alpha-2B subtype is mainly responsible for the initial transient hypertensive response, which is seen with the rapid high-dose IV administration of dexmedetomidine. So this is responsible for the transient hypertensive response with rapid IV administration of dexmed. Coming to the dosing, the loading dose is 0.5 to 1 mics per kg, followed by an infusion dose of 0.2 to 0.7 mics per kg per minute. Apart from its IV use, It is also used as an additive in regional anesthesia. So, as an additive to subarachnoid blocks, epidurals, regional nerve blocks. Then it can also be used to blunt the stress response to intubation, intra-articular use in arthroscopic surgeries. Then it can be used in neuroanesthesia to prevent increase in ICP, and it has also been used in alcohol withdrawal syndromes. Now, the pharmacokinetics and the pharmacodynamics of its drug. So, the onset of action is about in 5 minutes. The drug gets redistributed in about 6 minutes and eliminated by the body through hepatic metabolism and renal excretion in 2 to 3 hours. The peak effect is seen in about 10 to 15 minutes. The drug is lipid soluble, so it has a log octanol water coefficient of 2.8. So now what does this term mean, the octanol water coefficient? So this basically means that if we have a jar of water with water and octanol in it and we add Dexmed to it, so the concentration of Dexmed would be 2.8 times more in the octanol compartment as compared to the water. So just for reference, the propofol has a log octanol coefficient of octanol water coefficient of about 4.3. So dexmedetomidine is lipid soluble. So it is about 96% plasma protein bound. It has a pKa of 7.1. If taken orally, it has poor bioavailability of about 16%. Metabolism is mainly by liver. It has a high hepatic extraction ratio. Which means its extraction, its metabolism by the liver is dependent on the flow of blood to the liver. So the major metabolic pathways are glucuronidation, hydroxylation, and methylation. And the metabolites are inactive, they are excreted in the urine. So context sensitivity half-life. The context sensitivity half-life in case of dexmedetomidine ranges to about 4 minutes after a 10-minute infusion and can go as high as up to 3 to 4 hours after about 8 hours of infusion. Now coming to the pharmacodynamics, the effects on different body systems. As we know, on the CVS, it causes bradycardia. It reduces the heart rate. It reduces the systemic vascular resistance, leading to a drop in blood pressure and heart rate. Initial transient hypertension may be seen on rapid IV dose as discussed above, as mediated by the alpha 2b subunit of the receptors. On the CNS, it causes arousable sedation, which mimics our natural sleep. It causes hypnosis, and it causes analgesia both. spinal and supraspinal. It also decreases the cerebral blood flow, cerebral metabolic rate, and helps to decrease the ICP. Respiratory changes, it maintains the respiratory response to CO2. Coming to the adverse effects, so it can cause bradycardia, it can cause hypertension, nausea, and discontinuation can also lead to tachycardia, nervousness, headaches. Also, in some rare cases, dexmedetomidine can also cause diabetes insipidus. This is rare, usually occurs after prolonged infusions. So it is a transient side effect causing significant polyuria, which can either be due to decreased vasopressin secretion or renal resistance, and can normalize after stopping the drug. And it can occur due to decreased vasopressin secretion or renal resistance, and the effect reverts after discontinuation. Some trials associated with Dexmed, the names include the SPICE 3 trial, the MIDEX trial, the PRODEX trial, the MENS, and the DREAMS trial. So thank you for watching the video. So this content is just for educational purposes and is not constitutive of any medical advice. So all the risk side effects are not basis for recommendation of any specific treatment or a regimen. So always consult your physicians and always refer to your textbooks. So if you like the video, like, share and subscribe. Thank you.